Hello, everyone. Thank you so much for joining us today. My name is Safia McCarter. I am a graduate of Bastyr University, and I serve multiple roles here, one of which is as an alumni advisor for the Naturopathic Medicine program. I have the pleasure of being here today with Dr. Carrie Louise Donnell, who has practiced passionately and successfully as a results-driven naturopathic doctor for 20 years. In addition to practice, she celebrates her 25th year of service, leadership in the naturopathic profession, currently serving as the vice chair of the board of trustees of Bastyr University. An author, frequent radio host, and TV guest, including multiple PBS appearances, Dr. Donnell has served as guest instructor in many of the naturopathic program classes and as an internationally celebrated continuing medical educator. She believes that naturopathic doctors are uniquely qualified to engage in transforming the health of the human community. So with that introduction, I am going to turn it over to Dr. Carrie Louise to say a little bit more about herself, and then we'll launch into some questions, frequently asked questions with regard to practicing in a non-licensed state, and then we'll, of course, leave some time to answer some of your questions from those of you that are attending. So, Dr. Louise, over to you.
Thank you, Safia. So let's see. I think the thing that I would say first is that I am 20 years into this naturopathic practice, and I'm still excited to go to work every day. If I take a vacation or leave my office for too long, I get antsy to get back, and my staff always laughs at me because they're like, seriously, you miss work. I'm like, I seriously miss work. I don't have burnout, which I know a lot of people who are really good, smart people doing work that they love get burned out. And so I think it speaks to the magic of the medicine and how beautiful it is to be privileged to practice it. Like Safia said, I am results driven, obsessed maybe, and that makes my job fun. I feel like I get to go to work every day and sort of be a superhero, because people come to me and they ask me to work with them to restore their health in a way that has been taken to such a degree that they often don't even have a livable life anymore. And if I do my medicine in the treat the cause natural way that I learned how to do at Bastyr University, what happens is that I'm able to see the body do amazing things. Even at 20 years, sometimes I'm still amazed at what the body will do when you help it. See the body bring people back from a variety of different things that everyone else has told them is incurable, and I'm sorry, and that's your life, and we've done all we can do. And that includes places like Mayo Clinic, Cleveland Clinic, Canyon Ranch, you know, all the famous alternative medical doctors that have written books that practice in California and New York, where they've flown to see them. And I do the naturopathic medicine and then get their lives back. And there really isn't a high better than that so far. And so I'm happy to talk about practicing. My state became regulated about 4 years ago. So for 16 years, I practiced in a unlicensed state, and even now our regulation's pretty small. We don't have a lot of scope. At least we're a legally defined entity, but I'm happy to speak passionately about that as well, because as you can imagine, I've done all this wonderful work for a very long time in a place that didn't recognize me at all, and it's been a blast, and I've been very successful, and most importantly, my patients have been very successful. And so happy to speak about the fine details of that. Safia, I cannot hear you.
I didn't unmute myself. Can you hear me okay now?
Yep, I can hear you now.
I think that's a great start to this conversation, which is understanding, if you speak more to the difference between being regulated versus licensed, what the differences are between those two terms.
Okay, so I use the term regulated because in the state of Colorado, the Colorado Medical Society convinced the legislature to register us and not license us. They felt like saying the word license would perhaps legitimize us too much for their liking. And so we had the choice to either be registered or not regulated at all, and so we chose to be registered. There are a couple of other states where that is happening now as well, but most of the states literally license us. And even then, Safia, the truth is, as you know, every single state has a different scope. Unlike a medical doctor, where if you're licensed in California and you go to get a license in Illinois, you have to get that license, but the scope is the same in every state in the union. And in the United States for naturopathic doctors, in the state of Washington, where you are, and where I hold a license to this day, because I'm licensed as a primary care physician with prescriptive authority, the ability to practice family medicine on an outpatient basis, and do minor surgery. That speaks volumes to my patients that I have that and that I've earned that. So I keep that, even though it doesn't apply in the state of Colorado. In the state of Colorado, as a registered naturopathic doctor, at least I'm practicing as a legal entity. I can diagnose and I can treat using my modalities. I think I have the prescriptive authority to write an EpiPen. That's about it. Of course, I don't have enough scope to qualify as a category provider for insurance, so they won't cover me. And at the same time, I'm legal, which is great. It's great for my patients because they know who went to school and who decided to educate themselves in some creative way and hang themselves out there as a doctor. I'm not saying those people don't have anything of value to offer, because of course they do. Everyone on this planet has something of value to offer. However, when a patient's looking for a doctor, they have this expectation that they went to school for a long time and passed a bunch of exams, and some state department of health somewhere said that they were competent. And so it helps my patients know the difference between someone like me, for example, and someone who is self-named. And so I think that's kind of the sum total of the advantages to the regulation we have in Colorado now. It's very small scope. But in the state of Washington, insurance can cover us because we have enough scope to be considered a category provider, and that's primary care physician. And so it's just been an interesting road, and I have perhaps a unique perspective. I think my colleagues here do too. We kind of feel special and privileged to practice in a state that isn't wildly regulated, because it gives us a lot of advantages that you wouldn't assume on just looking at it. And so I'm thrilled to be here, and I don't yearn to be in a state that regulates me as a primary care physician. So I'm happy with it.
Thank you, Dr. Danelle. And I just wanted to ask you to talk a little bit more about what that looks like as far as patient interactions. So not being as widely regulated as we are in the state of Washington, what does it look like when a person comes in seeking care from you with the current scope that you have in the state of Colorado?
So I had a dream when I graduated, and I'm living that dream, and that dream was that I wanted to be the go-to expert to be able to organize all the care and resources for a patient in the toughest cases and solve those puzzles. I did not dream, actually, of doing PAPs and pelvics all day, or physical exams, or treating the flu or pink eye. That's just not my personal quest as a doctor. And so I thought, if I did that, I would be working outside of the system, and I would be working as a consultant, which means, quote unquote, I don't touch people. I'm not going to do your physical exams. I'm not going to do your PAPs. I won't be writing your birth control, because the truth is that there's a medical doctor on every corner that can do that, and they do it very well. And my patients all have them. And I don't feel the need to reproduce that care, and I'm not really that interested in doing it. It isn't enough for my brain. I'd rather solve the tough puzzles, and I would rather engage patients that have come up against a wall, having tried everything else, and still need a way forward in their health. And so when you come into my office, Safia, you talk with me. I take your case. And the reason I don't want to be in the system is because I don't want to be told that I have 7 minutes to take care of you. Because I can promise you that the way I do my medicine can't be done in 7 minutes. And so I love that I don't have somebody telling me that. So I spend about an hour and a half, and I joke, but I mean it. I just need to hear the whole life story. And they teach you in medical school, and this would be any medical school, not just ours, that 80% of the diagnosis with a patient, I don't know if you can see my eyes with all the glare, sorry. 80% of the diagnosis is truly from the patient. 20% is from exam and lab work. We have overemphasized lab work in our society, but we've lost the fine art of 80% of the diagnosis, and that's listening. And so there's a lot of listening that goes on in that hour and a half. And if I apply what they tell me to my 10 years of education and my 20 years of practice, I can help a person identify at the most causal level what's going on with them and why, and use the various different tools in my tool bag, which might be surgery, it might be a prescription medication, and if so, I'll make that recommendation and I'll ask them to go to their insurance covered provider and pursue it, and it will make sense and they will get it. And or it might also be natural medicine, it might be homeopathy, it might be nutritional supplements, it might be lifestyle, diet, it might be moving their body in a certain way, or pursuing a physical type of medicine. In any case, because of my training and my education, I have a really strong understanding of all the tools that would be in a healer's, doctor's toolbox. And even if I don't use them all every day myself, I understand them, I can speak the language of their conventional providers, and I can oversee a really whole medicine for that person. That could include natural, and more than likely will also include conventional, because that's what people want, is they want to have really strong providers in every category in their life, but they don't want to limit themselves to just one. And so that's what my day looks like. That's what it is with my patients. I happen to focus very strongly on the use of nutritional supplements, gaining a command of the mechanism of action of the active constituents and the ingredient list in supplements, which are the better versions, how they work in the body, and most importantly, helping to create a strategy to use them at the very causal level to correct health. Worst case scenario, I can use them to manage symptoms, which is really a good scenario because a lot of times it'll get a patient out of having to use a more toxic medication to manage symptoms. But whenever possible, I'm looking to use them strategically to resolve at the causal level their health challenges, so that ultimately I'm looking for another patient because they're off living their good lives and too busy to see me.
Thank you. So I'm curious then, with this, it sounds like there's a bit of a partnership between you as a naturopathic physician and the conventional doctors. You sort of comprise a healthcare team for your patients. How has it been establishing those relationships with members of the conventional medical community, given
Well,
the current status for Colorado?
in Colorado, and I haven't practiced in another state, but in Colorado, it's been fun. You know, everybody has their own politics and their own prejudices and their own biases. But what I found is that when you give people a chance, and you don't just assume that they know that you're brilliant, you know what their biases are probably. And you meet them where they are and you help them understand that, yes, I really do have two brain cells to rub together. Yes, I really did go to school for 10 years. Take that in. I really did sit for 5 days, 8 hours a day for 5 days, exams by the Department of Health in the state of Washington. And there, I'm licensed as a primary care physician, pause, with prescriptive authority, pause, and the ability to do minor surgery and practice outpatient family medicine. When they take that in and they begin to give me a chance, they realize that when we interact, I absolutely speak their language and I absolutely respect what they have to offer. And they respect me in return. And of course, 20 years later, I have a lot of them referring patients to me and sharing patients with me and getting on their cell phones on a Saturday afternoon and talking through a situation that looking through their filter doesn't make sense, but they trust that it does make sense to me and they want to know what I have to say about it so that they can support me to their patient, but right now they don't know how. And so those relationships have been really rewarding to have developed, and it's been really fun.
Thank you. So tell me a little bit more about building your practice, getting those patients in. You mentioned over time you've been able to generate some referrals from some of your conventional colleagues. What did it look like in the beginning, being in an unlicensed and now registered or regulated state?
Um, well, the nice thing about it, I guess, is there isn't one of me on every corner. And so even with all of the naturopathic doctors that have moved here over the last 20 years, because Colorado is a pretty fabulous place to live, there still isn't one of me on every corner. There is a lot of room for more. And what I did, my two favorite principles of naturopathic medicine, Safia, are treat the cause whenever possible and doctor is teacher. And so I teach. I would teach to 2 people in a church basement. I would teach in a living room at a women's gathering with 3 people that showed up because the other 2 couldn't make it. I would speak to a room of 50 or 300 at a health food store lecture facility. Basically, anyone and everyone who would have me, I would go and give a talk about something that they cared about, that related to something that I was good at doing. And it's so old school, Sapia, and it's so simple, but it's powerful because people have an opportunity to learn in a way that changes the way they make decisions on their own behalf after they walk away, and they know that they spent their time wisely by hanging out with you. And at the same time, they also say, you know what? That's the kind of person I can work with. I like how she thinks, and that's what I want. Or conversely, maybe that's not my kind of person, and they don't waste their time. Either way, it has always been an easy, simple, not rocket science, doesn't take any money, doesn't take technology way to let people know that I'm there and that I have something meaningful to offer. And that's really what it's all about, is just taking your enthusiasm for the medicine and making sure you say it out loud.
Okay, thank you. So if I'm interested as a prospective student or even a current student in practicing in an unlicensed state or a state with a smaller scope in comparison to a state such as Washington, for example, what do I need to do in order to set myself up for success in that situation?
Well, I didn't plan originally to move back to Colorado. Um, they say best laid plans, right? I thought I was going to go to San Francisco and work in an HIV clinic, and that just didn't work out. And then I thought I was going to stay in Washington, and I thought, wow, my dream doesn't fit very well in Washington, but I'm still going to live it, because I was concerned that as a fully licensed professional in Washington, that I knew the kind of medicine that I wanted to practice would not be covered by insurance, and yet so many of my colleagues were getting on insurance plans, and I thought, how are people going to find me if I'm not on an insurance plan, which I fully intend not to do because I will not practice in 7 minutes. Um, Fortune had it that I ended up back in Colorado at the last minute. So I hate to say it, Safia, but I didn't make a plan. And if you know me at all, I'm a plan maker. But I didn't make a plan, and I showed up and I found an office that had a chiropractor and a DO, and they had an extra office room. And I said, hey, can I share your space? And so I paid them for the room and started practicing. And I started lecturing or teaching, and they shared their patients with me, not a million, but enough to get going. And then I said, I'm gonna look for an office sometime this year, probably move down the street. And they're like, that's fine, we don't care. And I did, and I spent 10 years in that office, and now I'm 10 years in my second office, was 6 blocks west. Um, and it was not painful. I did what I needed to do very simply. I didn't have a lot of money. I didn't really have any money. I started with a desk and a chair and a conversation, and I made sure that I had the tools that I needed and the nutritional supplements that I used most, just a few of them around so that patients could have them when they needed them. And I started. And it's grown, of course, from there over 20 years, but it's still a very simple business model, and it's still incredibly rewarding for my patients, which is the reason I get out of bed every day. And so I think if I had to do it thoughtfully, I would probably make an effort to network with the doctors in the state. And it would be, first the naturopathic doctors. But somebody reached out to me from Vassar University recently I think she's about to graduate next year, and she's like, hey, I want to go into this and this, and I want to collaborate with a conventional provider in this specialty area. And I thought, how brilliant. And so while I didn't have a name for her in her area, because it's not my area, I did know who probably would. And I connected her with a naturopathic doctor who could connect her with the conventional providers who do that kind of medicine. And so I think her plan is to perhaps share a space or rent an office or a room in a conventional provider's facility that does something along the same specialty area as her, but of course practices very differently, which is also a good idea. So there's power in networking and making connections before you get there, kind of learning the lay of the land. And also, in Colorado, do you want to live in Colorado Springs? Do you want to live in the mountains, Denver, Fort Collins? Figure out where you want to be so that you can focus on that area before you get there.
Well, so in addition to figuring out where you want to be, what other advice would you give with regard to networking to folks that are thinking about, I think this applies to practice in general, but specifically in unlicensed states. Talk a little bit more about the power of networking and the avenues that might be best for those kinds of opportunities. Where should a prospective student or current student be going? Are there particular organizations that they should consider looking into becoming student members of to facilitate that process and building that community?
That's exactly what I was going to say. Our profession is organized on a national level, and that's called the American Association of Naturopathic Physicians. You can go to their website and click on Find an ND as anyone in the whole wide world, and you can click on a state or a city or a zip code, and the names of the members that are in that area will pop up with their contact information. So that's a great place to start. So if you're a member of the American Association of Naturopathic Physicians, it's automatic that you went to school and that you're licensed somewhere. And so that weeds out anybody who would use the term naturopathic in some way that really isn't what you're looking for. And then that association was originally founded as a confederacy, kind of like the United States, where we have a national thing and we have a state thing. And so every state that has a collection of naturopathic doctors in it typically has an association of their own. So in Colorado, for example, Colorado Association of Naturopathic Doctors, because the term physician is protected by the MDs and they won't allow us to use it. So that's the name of our association. But if you go to their website, you will probably find an even longer list of doctors that are local and be able to identify the ones that are in the city that you want to practice in. And just start there if you don't know anyone. And then reach out, make the connections that are meaningful, join their associations as a student member so that you're always in touch with what's going on. And it is amazing how you can go from 0 to 60 on making connections and getting a feel for what's happening.
Thank you. So I'm just curious, you mentioned a certain level of access that would have been afforded to you with being credentialed by insurance companies, but also some of the limitations that came along with that you were not excited about. And I know that is a concern for many people, that having a greater amount of access to naturopathic physicians and having that option as a part of their insurance and also as a income generator. So in practice, when you don't have access to that in an unlicensed state, we don't have access to being credentialed by insurance companies. Can you speak to the financial aspect of practicing naturopathic medicine? And does it make sense from an income perspective to practice in the way that you have been over the past 20 plus years?
Well, one of the hurdles you have to get over when you do want to engage in the insurance covered system, let's just say you can hang with reimbursement for a 7-minute visit, and somehow you've decided you're going to make that work. If you want to spend more than 7 minutes, it will become challenging to pay your bills, because that's why the doctors do it that way. The medical doctors don't want to spend 7 minutes either. That's not why they went to school. But the insurance companies really do kind of own healthcare right now, and that has evolved over the last 30 years. And so if you can figure out a way to do it, there are going to be a lot of front-end costs, because with engaging with insurance companies, you're going to have certain technology, you're going to have certain skilled staff to be able to file the claims just exactly the way they like it. You have to be ready to wait up to 3 months to be paid part of what you're asking for. And what you're already asking for is low and would cover about 7 minutes of your time. And so I'm not sure I see that as an advantage, Safia. And I know that there are people who are making it work, but I haven't seen it up close and personal enough to speak intelligently about it. That is not a simple, low-cost, easy entry, in my opinion. I think the advantage of us being covered, however, which I fully support, is that if somebody can subsidize our care, or anybody's care for that matter, through a third-party pay system, a lot more people from various different financial demographics could have the advantage of our medicine. And so if we were licensable or licensed, for example, a county community health center could choose to put our doctors to work in those facilities and pay their salary as they would anyone's salary who's doing that care, because we know that the people that are being served are not fully financially supporting that. It's part of social services. I would love more than anything to see that as an opportunity and as an option, not only for patients, but for my colleagues who are wildly excited about going into that kind of medicine. When I graduated, that just wasn't an option. I feel like it's slowly becoming more and more of an option. And so it's not like I don't believe in having us covered. It's just that when I started out, going to a place where we weren't covered actually made it simpler, because I could just open my door, start a conversation. I didn't have to pay for expensive technology and staff who are highly trained to interact with all the rules and regulations of simply trying to get paid for the service that was just provided. And so while some people see it as maybe a detriment to practice in a state that you're not covered, maybe financially it's okay. And while I do not serve people who can't afford to pay for my care because they aren't being covered for my care under insurance, it doesn't mean that me and people like me don't have a strong give back personality. I just simply donate heavily to causes that I feel like will help sort of begin, because I know it's not as dramatic as we wish, but level that social justice playing field where people aren't getting care and access to services that I believe they should. And so I have an organization here in Colorado. We call it the Mamas and the Babies, but it's the gathering place, and it's a resource center for homeless mothers, and it helps them get their GED, get food, get clothing, get a shower, get daycare while they look for a job, access to a computer, and get back into a home and a life that is safe, that can provide for their families. And so that's the qualified charity that I give to, because it matters to me that I can make a difference, even though I can't serve the people that are covered by insurance. And so that's what I do with it, and that's how I've made sense out of it, and it's not been a problem for me to say, hey, I have something of value to offer, and for people to come and pay me to do the good work that I was trained to do.
Okay, thank you. And I'm just wondering if you know, through conversation with some of your colleagues, as you mentioned that the way that you're able to give back to communities that may not be able to pay you out of pocket is by donating to organizations that then support those communities. Do you know how other NGOs in the Colorado area may be able to work with, let's say, lower income underserved populations?
Everybody does
Access to insurance?
Yeah, all kinds of people have different models. Some of them have discounts. Some of them have pay scales depending on your income. Some of them have a free day. Once a month they have a free day on a Saturday, and they say anybody who wants to come see me between these hours and these hours, come, no matter who you are, no matter what you have. Some people have pay as you can. So people have all kinds of different models. It's really only limited by your imagination and your desire to do that kind of work. I've decided personally that I want to keep my work and keep my charity, and that works for my business model, that works for my personal life and my sanity and my heart. And everybody has a different way of managing that. And this just happens to be my way. I just give money, just plain out hand the money over.
Okay. Okay. Let's see here. I'm looking at time, and I want to make sure to get to some of the questions that we have from the attendees. So I'm just going to take a look through some of the things that have come through. Let's see. There's a question here about student loans, and so I'll just read the question if that's okay.
Okay.
I'm a current third-year ND student and would like to know if you are able to sustain your family financially and afford to pay student loans with your practice, or did you supplement income with other opportunities such as books, products, etc.,
Did I supplement my income with other opportunities?
such as writing books, developing products, or some other venture?
Okay. I took an indefinite sabbatical as a consultant, as a scientific and technical advisor in the nutraceutical industry in 2008. So I have not been being paid to do anything else for quite a while now, I guess 10 years. But for a long time, I did work as a scientific and technical advisor. So I was a consultant. I made anywhere from $400 to $10,000 in a month as a consultant, just depending on the need. But I always practiced. My practice was always my major primary thing. And the rest of it I did because I was just so passionate and excited and I had so much fun and somebody wanted to pay me to do it. I didn't make any money on any kind of writing. Honestly, it's just not even people that write books will tell you it's not, you don't get rich when you write a book. What else? Yeah, so in my first year of practice, I was able to pay my bills and have a life. And I started practicing July, so I thought that was pretty good because it was so simple and I had just started out. And I've grown that over the years because I am 20 years in, and I do still feel that that I make a good enough living to, and this is how I qualify it, and I think this is important. I want to make a good enough living to be comfortable to provide for my family and keep a roof. I want to be able to put my son through college. I want to be able to plan for my retirement, and I want to be able to pay off my student loans. And I've been able to do that, and I am 20 years out. I just refinanced my student loans because I had a lot of equity in my home, which means I paid it down faster. But now that I have my MBA, Safia, I know that that was the wrong way to do it. My student loans had high interest. My home loan had low interest. But I did have the capacity to pay something down quicker. And so I swapped that out by refinancing my home to pay off my student loans. And so if I had done it in the other direction, my student loans would be gone by now. And they are gone because I paid them off in this other way. And I still have equity left in my home. So I just paid it in the wrong direction, but I did have extra to pay it down faster. And if anybody who's listening has student loans, pay them down faster. That compounding interest is, wow, it's really something. And I did have the ability to do it. I just didn't have the smarts to do it in that direction. So once I figured it out, I just moved those resources over. But it's doable, but you have to really go after it like you mean it and set up your practice and work for a living and pay your bills. And so it's worked out. I know that it's not easy because most of us wanted to be a doctor. We did not want to be a business person. Same for me. But I had to figure out how to be a business person, at least in the most simple way, and a little bit marketing too, in just the simple way of saying, hey, I can help you with this. No, I can't help you with that. Just so that people know how to find you. And then when they find you, if you do a good job, that's marketing too, because they tell their friends and their family and their doctors. And so in a nut, Safia, I think it's safe to say my student loans are paid off and I'm able to do the things I listed, which I think everyone should be able to do if they go to school for this long and borrow that much money.
Mm-hmm. And since you just mentioned it, can you talk a little bit more about This goes back to that practice building question I asked a bit earlier. How did you market yourself? How did you present your brand and this profession of naturopathic medicine?
I feel like you don't like my answer, Safia.
I know.
Oh, I mean, I wish there was like some kind of magic you could just go buy. It is really as simple as I get really excited, and if you talk to me on the street, I'm going to tell you what I can do because it's so dang exciting to be able to do it. I do go teach. I teach and I teach and I teach. In the very beginning, all I did was lecture at, there was a senior education program here, and I would lecture there about every month. Um, there was a health food store that had an education program. I would lecture there about every month, maybe every other month. And then 10 years ago, so 10 years in, I got enough space in my new office that I now hold a monthly class in my reception area. So I hook my laptop up to a TV that's, I don't know how this goes, on the wall, and I use it as a monitor, and I go through my slides and I teach people about everything from sugar addiction to resolving autoimmune diseases to repairing the gut to reversing bone density challenges. I mean, whatever it is that my patients truly care about, if I know how to do it, I'll end up writing a class on it and giving that class. They bring their friends, they come over and over again because they always learn something new every time. And it reminds them what they're doing, why they're doing it. It reminds them to think about something else they hadn't thought of. And so I think the most powerful thing I've ever done is to teach, to lecture, to give classes. And it doesn't have to be some fancy thing that is, it's literally in a church basement. It could be two people. I had one person show up once. I gave the lecture. I love what I do and I don't mind talking about it. I think that's one thing. The other thing was that in those earlier days, by earlier I mean probably the first decade, and I'll still do it now, is the networking. If I find out one of my patients has a medical doctor that's even remotely respectful about what we're doing, I'll give them a call and I'll ask them if I can come to their office, bring them a cup of coffee, have a little chat about what I've been doing with patients that I've been sharing with them, and learn more about what they're good at, etc. Concierge medical doctors seem to like me the most because people pay them cash to help them find the best resources and specialists. And so they don't have the prejudice so much. They just want to deliver for their patients. And so if I can help their patient be so healthy that they don't call them all the time, they love that. So it doesn't hurt their feelings when their patients say, you know what, I have a cholesterol problem. I don't want to use a statin. Who can take care of me that you trust? They're like, Carrie Louise Donnell, I'm going to send you right over there. And so that's a really strong referral when a medical doctor looks a patient in the eye and says, you need to see this naturopathic doctor. Or, my gosh, you've got this chronic fatigue and this terrible IBS, or you failed 3 drugs with your ulcerative colitis, and I don't know what else to do with you, but I've heard she can work miracles. Why don't you go see her? So that's another way to market my practice. For some period of time, and I'm not doing it right now, I would do television interviews on a local TV channel, and I would give them money and they would have me as a guest. Now they have to choose to have you as a guest. They don't let anybody and everybody do that, but they decided I was a good guest to have. And they would interview me for 5 to 8 minutes on a health topic. And people would call and say, hey, I want to work with her. I haven't been doing that in the last couple of years because something changed with their show and they started featuring, I would say, an inordinate amount of non-surgical fat reduction technology in a way that I think started turning people off. And so they stopped watching, and so I stopped going. Interestingly, though, as I moved away from that, my practice still grew over the last year. But with people who came back or were friends or family or referred from people who had worked with me, which is quite frankly a stronger referral than someone who just sees you on TV and they don't know what you're about and they just call. So it's been an interesting lesson to learn in marketing and advertising that sometimes your biggest fans are your best referral sources.
Okay. And let's see here. Looking at another question. Do you offer any telemedicine services? The first part of the question, and the second part is that a service that NDs should consider offering their patients?
Do I offer any kind of medical services? What? I didn't understand.
Do you offer any telemedicine services?
Telemedicine.
Yes.
Um, yes, because I'm a consultant, I literally have a conversation with people. So that puts me in a different category than, say, a primary care physician doing telemedicine, right? And so from the very beginning of my practice, though I didn't intend to, I have worked with people all over the country and all over the world, because at this point they find out that I'm the one to see when every other natural doctor has tried and failed with your digestive system. And my colleagues will even send them to me, and the word gets out, and they come from Singapore, they come from Canada or India or Europe or New Zealand. And it's hard to work with people out of the country, but it's easy to work with people all over the United States. And so I do that all the time. I didn't mean to or want to, but it all started because I was very good at Hep C, and I had a patient call me from Louisiana, and I had no one to send them to. And they said, well, why can't you just work with me on the phone? I read your paperwork. You don't need to really see me, do you? And I thought, I guess not. And she responded very well, and I'd never met her, and she got well just the same. So I moved forward, not saying no to people from a distance after that. And what was the second part of your question?
Is that service, speaking of telemedicine, something that NDs should consider offering to their patients?
Of course. I think every doctor ought to do that. There are a lot of reasons. I just finished the MBA program at the University of Colorado, and one of my classmates is an emergency room doctor. And, he could make a huge case for telemedicine for acute care in an urgent setting, but not necessarily, that pre-urgent setting where you could offer services to people in rural areas who literally cannot drive down the road within an hour and get to somebody, but they need to decide if they should try and drive the 2 hours. And so even then, for conventional medicine in a pre-urgent setting, telemedicine has a lot to offer. I just think that access to somebody who knows what they're doing is better than not for any doctor.
Thank you. Can you talk about liability concerns and professional liability insurance?
The fun thing about naturopathic medicine is that we don't hurt people. When you look at the stats on how often a drug or a surgery or a procedure that is conventional either causes harm or literally takes life, it's kind of staggering when you think about it. And you look at those same numbers for what we do, and it's flatline. There's just nothing there. And so when you go to pay for liability insurance, which of course it all comes down to money, it's reflected in the fact that it doesn't cost anything because we don't hurt people. And it's nice to not hurt people. And so I guess it depends on how highly invasive your work is. There are people in our profession that do all levels of care. They're doing IV therapies, they're doing injectable joint support, and it's all beautiful medicine. But I would assume that their liability coverage is going to be more expensive than mine because I'm not entering the body. But net, natural medicine is miles less harmful, and so the liability issue is a fraction. But any doctor, right? Like, heaven help them. Any doctor, as soon as you interact with another human being, depending on what they bring to you, their genetics, what they've exposed themselves to, their lifestyle, it's there.
And I don't think we don't have any more questions coming in at the moment. So I'm just interested in the landscape for naturopathic medicine. What do you see as the future for naturopathic medicine? I would say starting in your area and then just globally, what do you see as the future of naturopathic medicine?
Well, I'm sure everybody has their own opinion. Like my bio says, I believe that naturopathic doctors are uniquely qualified. to bring real health restoration and resolve the health crisis in the human community. And I say that very literally because I don't think it's the same thing as somebody else who's conventionally trained using some natural tools. We are trained from day one, and we go to school and we are formally educated in treat the cause natural medicine. And at the same time, we're formally educated to be basically competent in outpatient family conventional medicine. That is truly the best of both worlds. And someone who spends their entire career studying conventional, for example, and then taking seminars on the side to learn some natural things, it's not the best of both worlds. It's wonderful, but it's not what we are. And I think the reason that matters is because, Safia, the sickest of the sick are going to need more than that. The sickest of the sick end up in our offices and they find their way back to health, which really is freedom and the ability to make the contribution they came to this planet to make. And so I see the naturopathic doctor as an absolutely essential part of the healthcare team that ought to be available to every single human on this planet. And I know I'm saying a big thing, and I know somebody has to pay for that, and I know that's hard, but somebody's paying for a whole lot of stuff already, billions and billions of dollars. And people seem to be getting sicker and sicker, not healthier and healthier. And the naturopathic doctor, I think, is uniquely qualified because we emphasize treat the cause medicine to help restore health, which would unburden the lives of humans who have contributions to make, unburden the financial systems of governments, and open up the creativity and the contributions that the human community has to make on making a difference in the planet, on reducing our carbon footprint, in investing in more humane ways of just walking around together here. And so in my fantasy, we would be regulated with a full scope of practice in every state in the United States to begin with. And this is just keeping it here in the US. I'm not saying we don't have value in the rest of the world. We absolutely do. And we would be incorporated in all of the third-party pay systems, and everyone would have access to our care regardless of their ability to pay for it. And we would be compensated in a way that was commensurate with the way we practice. And no naturopathic doctor can do good medicine in 7 minutes. So we would be paid not for 7 minutes while we spend an hour and a half, but for the time that actually takes to do the medicine right. And we would begin to make a difference in unraveling this crisis and setting the human community back on a strong health footing.
Thank you. I have a couple of questions here. And I think you may have touched on this one that I'm about to read, but I'm going to go ahead and ask it anyway. How do you get around not being able to diagnose and prescribe things for your patients in an unlicensed state?
You know, every state is different. Some states are really hostile toward us, and so Colorado wasn't. And so I didn't have to face, for example, I think one of the Carolinas was really hostile. New York State was really hostile. It's ironic because New York State is the #1 place where people pursue natural medicine, which was a surprise to me, but it was also one of the most hostile toward anybody other than a medical doctor trying to practice. In Colorado, the Department of Regulatory Agencies recognized that for 24 years, we had sought to set standards and follow them, and that the legislature simply didn't go with us for those years. And so for them to enforce, and they chose to say, you know what, we see what you're doing, we appreciate it, and we're not going to persecute you. And so the way I handled that is that I wasn't one of those people who was doing IVs when I know darn well that you can't be doing that in a state that doesn't regulate you. I didn't even make my own medicine in my office with tinctures. Like some doctors will take big bottles of tinctures, of herbal tinctures, which are powerful medicine, and mix them up for the patient at that time. Lovely. But it's a level of liability and a level of risk that really doesn't follow the law in a way that I was comfortable. And so I'm one of those people that really likes to follow the law and also follow the tax law. So I don't cheat on the law and the taxes. And so I made my practice very conservative. So everything I had in my office was in a bottle that was legally labeled and sealed, and those were my tools. I didn't touch people, and I did not diagnose. I gave them consulting recommendations on how to manage their health. And that's what they paid me to do. I made it very clear in my paperwork that I could not replace their conventional primary care physicians or their specialists, and that they would have to have one in their lives in order to even work with me. And I just kept it simple, because I know that even though I have the training to be a competent primary care family doctor, and that informs everything I do, and it's so valuable. It's so valuable for my patients that I know that stuff. I will never run out of good work to do only using the natural medicine. And that's what I went to school for. I wanted to be a natural medicine doctor who had a command of conventional, so that I could wisely recommend navigating whole person healthcare for people who wanted to make the best of all of what was available in medicine. So that's what I did, just very conservative.
Thank you. And again, this may have been something that you touched on a little bit earlier, but I am going to ask again for some folks that may have just joined us. What have you seen as the greatest challenges in practicing in a state like Colorado versus a state with a wider scope of practice, such as Washington State? And how did you overcome those challenges? So what did you see? What do you see as some challenges in practicing in a state such as Colorado, and how did you overcome those challenges?
Safia, I'm a glasses half full person. I will be that way probably till my last day. I don't see a lot of challenges, and I know that's not helpful. But I guess one of the challenges would be that even 20 years later, a day does not go by when somebody says, "What do you do?" And I say, "I'm a naturopathic doctor," and they say, "Nature a what?" I have to pronounce first what I do. And then they say, "What is that?" And then I have to define it. And I say, "We are formally educated and credentialed by the State Department of Health, where we are credentialed, to be licensed primary care physicians who are also experts in the use of natural medicine and how to make the most out of both worlds for our patients." In Colorado, however, our regulation limits our scope of practice, so I work as a consultant. It's like that. So I never stop defining who I am and pronouncing what I do. If my ego was bothered by that, I might be annoyed. I'm not. I always see it as an opportunity to spread the love of naturopathic medicine and garner awareness for what we do. And I don't need to be recognized for being brilliant and fabulous as a doctor, which medical doctors just automatically get that. You say you're a medical doctor, people make assumptions about you, right or wrong, that you're amazing. They don't do that with me. And so fortunately, I don't need that. But what I do get to do is help people against all odds create miracles in their health life every day. And that's enough high for me. But I would say a drawback is that people still don't know who we are and what we do often enough, especially in a state that doesn't regulate us. And the other question I get often is like, what do you say to the medical doctors who don't like what you do or don't believe in what you do? And I say, I don't say anything to them because they don't talk to me. And so it's like this perceived challenge that has never been a part of my life in 20 years. Like, the people that aren't interested in me don't bother me. And the people that are, it's beautiful. And so it's been pretty lovely overall.
Wonderful. Thank you so much. So we are now at time. Thank you so much, Dr. Danelle, for all of your responses, for your honesty, for your openness with regard to your practice and just your the journey that you've gone on in your career over the last 2 decades, 2+ decades. If there are additional questions that folks want to send to that want to send in that did not get answered, or if they come up a little bit later, feel free to pass those along, and we'll get those answers back to you as soon as we can. So thank you again, Dr. Danelle. Yes, I'm going to put mine up too. I'm biased. Thank you, thank you, thank you so much for your time and your expertise and your passion and your contribution to this field and to this medicine.
My pleasure. Absolutely. I hope that the people listening, if this is what they're meant to do, they don't hesitate.
Thank you. Thank you, everyone, for joining us. We appreciate your time and your attendance and all of your questions. Thank you. Bye, Dr. Danelle.